Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Cyclophosphamide. It is an alkylating agent derived from nitrogen mustard. Available in tablets 25 mg, 50 mg and IV injection. Recommended dosage is 1 to 3 mg per kg per day. Coming to its pharmacology, absorbed well from gut. It has a high volume of distribution so that it can cross blood-brain barrier, easily crosses placenta and even found in breast milk. It reaches peak within 2 hours of administration. It has high bioavailability of 75% and very low plasma protein bound, that is 20%. T-half of 5 to 9 hours. It is a prodrug, so it will have high T-half. It is metabolized in liver and excreted via urine. After administration, cyclophosphamide, which is a biologically inactive prodrug, gets converted to 4-hydroxycyclophosphamide and aldophosphamide inside the liver with the help of enzyme CYP450. After that, it enters the cell. This hydroxycyclophosphamide and aldophosphamide will easily cross the cell and enters into it, and there inside the cell it forms active metabolites called as phosphoramide mustard and acrolein. This acrolein is the culprit which causes hemorrhagic cystitis because it is urotoxic. Acrolein enters blood, eliminates via urine. Urine stays for some time in urinary bladder. At that time, it gets attaches to the urothelium and irritates it, causing hemorrhagic cystitis. In future, because of this, it may have increased chances of getting bladder cancer also because of this culprit acrolein. What we can do to avoid this side effect? We can prehydrate the patient before giving cyclophosphamide so that urine will pass continuously without making the acrolein stay much time inside the urinary bladder. And we can also give Mesna, sodium mercaptoethane sulfonate, Mesna. It binds to acrolein and makes this acrolein inactive and non-toxic to the bladder. Coming to phosphoramide mustard, it is a active cytotoxic metabolite which continues our mechanism of action. It alkylates DNA. Cyclophosphamide is a alkylating agent because of this phosphoramide mustard which alkylates the DNA, leading to DNA cross-linking, apoptosis and ultimately cell death. Hence, it can be used as anti-cancer drug also. In our DVL, we are using this immunosuppressive action, which mainly suppresses B cell activity and regulatory T cells. B cell activity is reduced so that we can use in various immunobullous diseases like pemphigus vulgaris, bullous pemphigoid, cicatricial pemphigoid. Only one US FDA approved use is mycosis fungoides. Off-label uses are autoimmune diseases like SLE, scleroderma, dermatomyositis, neutrophilic dermatosis like Behçet's pyoderma gangrenosum, erythema elevatum, diutinum. Vasculitis like Henoch-Schönlein purpura, leukocytoclastic vasculitis, granulomatosis with polyangiitis, microscopic polyangiitis. Miscellaneous diseases like Stevens-Johnson syndrome, erythema multiforme major, Langerhans cell histiocytosis, lichen myxedematosis. All these are list of off-label uses. Only one FDA approved use is mycosis fungoides. Coming to contraindications, pregnancy and lactation is an absolute contraindication because it is a category D drug and it can easily cross the placenta. When WBC count is very less, that is less than 4K. History of bladder cancer, hypersensitivity for any drug. Relative contraindication, abnormal LFT, RFT and active infection. Coming to adverse effects of cyclophosphamide, for any drug, first we will write GI side effects. For cyclophosphamide, we have to write genitourinary side effect first. As it is a gonadotoxic, it causes azoospermia by affecting testis, amenorrhea by affecting ovaries. It mainly attacks the germ cells in testes and ovaries, leading to its failure. Urinary side effects like, as I already told you, acrolein is a urotoxic which causes hemorrhagic cystitis. Treatment is Mesna and hydration. GI side effects, nausea, vomiting, diarrhea, hepatotoxicity at high doses. Same like azathioprine, it is also a prodrug. It is getting activated into its active drug, which is a toxic metabolite. Same here also, that active metabolite is very toxic. Same as in azathioprine, I have told 4H. Here also same 4H is coming. Hepatotoxicity, hematological side effects, leukopenia, thrombocytopenia, hypersensitivity, hair side effects like anagen, effluvium, carcinogenesis like bladder cancer, as I already mentioned, because of acrolein. Other cancers are squamous cell carcinoma, leukemia, non-Hodgkin's lymphoma. Irreversible pigmentation of skin, nails and teeth can also occur with cyclophosphamide. Coming to investigations and monitoring of cyclophosphamide, we have to do CBC with differential count to check for WBC. If it is less than 4K, we should stop the drug. With platelet count to check whether the platelets are less than 1 lakh count to stop the drug. Urine analysis to check for RBCs. If we find any RBCs in the urine, that is hematuria, we have to suspect hemorrhagic cystitis. So it is very important to do all these tests weekly once for first 3 months, then bi-weekly for another 3 months. Thereafter we can do monthly once. LFTs, RFTs monthly for 3 months and then quarterly. Quarterly means 4 months once. Pregnancy test, as it is a powerful gonadotoxic. If ovarian reserve, that is primordial follicles, every primordial follicle is affected, a person, that female cannot become pregnant for her lifetime. So it is very important to check pregnancy test if female is in reproductive age group. Follow up every 6 months to screen for cancers like lymphadenopathy and pap smear for females. Even if we want to do pap smear in males, we can't do. Drug interactions. These are the list of drugs which reduces the serum levels of cyclophosphamide. Dexa, prednisolone, phenytoin, ondansetron, nevirapine and rifampicin. These are all enzyme inducers, so that drug will be metabolized and reduced. Here are the list which increases cyclophosphamide. Allopurinol, same like azathioprine, allopurinol, chloramphenicol, chlorpromazine, ciprofloxacin, fluconazole. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.